Hello guys, Dr. Markle here of Centeno-Schultz Clinic. Today we're talking about a syndrome called Facet Syndrome, a common cause of typical low back pain, and historically treated with steroid injections, nerve ablations, and eventually sometimes even lumbar fusions. So today I want to go over the options of what exactly those treatments are and talk a little bit about some alternative treatments to ideally avoid some of those other treatments and long-term wise avoid the need for surgery. So let's talk about basic lumbar spine anatomy. First, understanding the anatomy, and then we'll get into some of why we treat it and what we treat it with. So the lumbar spine is made up of 5 different lumbar vertebrae. And they're basically lumbar bones that are stacked on top of each other, and they're connected in the back part of it. In the back part of it, we see this small oval circles. There's 2 on the top and 2 on the bottom. And when those guys are stacked on top of each other, those ears sort of articulate with each other, and each portion of the ear is covered with cartilage, similar to like your knee joint or any kind of cartilage joint in your body. It's just in a smaller version of that. So here's a pictorial representation of when you actually stack them on top of each other. They form this joint right here, and that is your facet joint. Over time, facet joints themselves can become degenerated, painful from trauma, instability of your back, putting some extra stress on those joints. In your lumbar spine, when we look at the spine in general, you've got 10 different lumbar vertebrae there, or 5 lumbar vertebrae that connect, one on the right, one on the left, creating 10 different facet joints. So here they are all highlighted. Typically, the most common ones that cause pain are going to be your L4-5 or L5-S1, which is the lower 2 segments right in this area. And connecting the bones together are a network of ligaments around those areas. So these ligaments come important when we start talking about some alternative treatment options, because these ligaments are some of the structures that support these joints, and we'll go into a little bit about how we exactly treat those. So Facet syndrome typically creates some low back pain, and it's from some degeneration or wear and tear of those articular cartilage, creating typically extension back type of back pain, meaning when you lean backwards, you put some extra stress on these joints and it creates some pain. And then treatment options, or if it continues to go on, those joints do become arthritic, bone spurs start forming, and that's when treatment, usually the back pain starts becoming more persistent, chronic, and daily, and debilitating at some point, where you start seeking treatment. So if we look at traditional pain management for chronic low back pain from Facet syndrome, typically you start with a corticosteroid injection if some other conservative treatments such as physical therapy or working with a chiropractor, some of those things don't really improve. Steroids are the next options from a pain management perspective. The problem with pain management is that sometimes steroid injections, you can only do a few of those. So when you run out of those, then you start going into what's called medial branch blocks, meaning you put some numbing medicine around a nerve to that joint. If the pain goes away, that's a diagnostic confirmation saying the pain's coming from that joint. And then they proceed with what's called the nerve ablation, where they burn the nerve to the joint, which shuts off the pain signal coming from that joint. And then ultimately, if all that fails, you're talking about a fusion, which is worst case scenario. So let's talk about the steroid injections. As I mentioned, you can only have a certain amount of those because we do know that those steroid injections are actually damaging to your joints. So our hope in doing a steroid injection is that the pain goes away and we're able to do your physical therapy, strengthen all the muscles around it, at the cost of wear and tear to your cartilage, meaning we do know from a high level of research at this point over the last 50 years that steroids are toxic to your cartilage, so that wear and tear, the steroids can actually advance that wear and tear, meaning they can make this arthritis in those facet joints worse over time, which is again something we want to avoid. So That's why certain doctors only limit a certain amount of them. But the problem with that, if you keep doing it, you eventually get so bad that you may need a fusion or go forward to that radiofrequency ablation. So if we talk about radiofrequency ablation, most of the spine treatments are more of a masking treatment option, meaning they burn the nerve to it. They want to shut off the pain signal coming from that joint. And the problem with that, you've got some overlying muscles that support and protect your back that nerve also goes to. So one of the downside complications or consequences of a radiofrequency ablation is burning the nerve to some of those core low back muscles called your multifidi. And if those are weaker, it goes down that rabbit hole where the nerve grows back to the joint, but not so much to the muscle. The arthritis has progressed some to the point where the muscles can't protect your back now. So your back becomes weaker, further exacerbating the arthritis, and eventually sometimes the nerve ablation stops working, and at that point you've already damaged a lot of your low back muscles, so even physical therapy isn't even working at that point because you've essentially de-innervated some of your core low back muscles. And this is one of the downside effects and consequences of long-term radiofrequency ablation. And one of the main reasons why we stopped doing radiofrequency ablations probably about 15 years ago, because of this fact. We understood and realized what we were doing, and we came up with some better options. So failed back syndrome, meaning if all those eventually fail, you're talking about a back surgery, a lot of times surgery. The problem with surgery, that doesn't help a lot of every patient itself. If we look at the numbers over the last 50 years, we can see substantial increase in lumbar fusions, meaning a lot more people are needing and requiring fusions, also meaning that those other treatments have failed to actually get patients better, requiring patients to need fusions over the last 30 years. Almost a 3 to 4-fold increase in the number of surgeries alone. But with that, back surgery is only like a 50-50 kind of improvement. 50% of patients are successful. And then if they're fail from back surgery, that requires additional back surgery, and those have diminishing returns. The more back surgery you do, the less successful it tends to become. And ultimately, this puts a huge strain on the U.S. economy, as well as your own pocketbook, getting you out of work longer, a lot of co-payments from the big surgeries, and hopefully no complications arise. And that's just more time in the hospital, time out of work, and more costs to the bottom line. So this has been a very costly endeavor over the last 50 years, talking about chronic low back pain. Most of it's from Facet Syndrome, some disc injuries that we get to in subsequent videos. So we came up with some alternatives to treat Facet Syndrome, which is ideally healthier for you and long-term wise can avoid the progression of the disease, preventing the need for that fusion. So one of the main treatment that we actually use for Facet Syndrome is from your own blood, called platelet-rich plasma or platelet lysate. Now, platelet lysate is a newer technique where we take some growth factors from your own blood. Those growth factors have been shown to actually protect your cartilage and shut down some inflammation in it that creates pain. So it's been highly studied over the last probably 10 plus years. That's showing very significant improvement. There's been prospective randomized control trial. If we're talking about evidence base for this, it's the highest level of evidence that exists. It's called a level 1 study that shows PRPs far superior to steroid injections, as well as your general traditional physical therapy. It can be just as beneficial, if not more beneficial. And then most recently, a huge study has been conducted on all the studies from a research perspective over the last 2 years that's showing that PRP is very effective, it's low risk, and there's substantial amount of evidence from level 1 to level 4 studies, meaning some intermediate level studies as well as the highest level research study that exists. So the amount of research that's been done is substantial. One of the things other physicians, even physicians that we work with on a daily basis, some of those physicians aren't familiar with research. They don't do this type of research or treatment options. So a lot of times they haven't been well versed in the research that exists. Now, if we're looking at arthritic conditions, platelet-rich plasma has substantial amount of level 1 randomized controlled trials that's been done over the last 15 years. So it's no longer in that category that a lot of people say it's experimental. There's not a whole lot of research in it. We've published research on this, as well as there exists a huge amount of research showing how it works, why it works, when it works really well. And then the way we utilize the platelet-rich plasma is a holistic approach. That stability, all those ligaments that we mentioned earlier, also protect those joints. So when we're treating someone, we're not just treating the facet joints, we're treating the whole spine as a functional unit to sort of maximize your own ability to heal yourself and long-term wise prevent the need to go down that pain management role, such as chronic pain medicines, steroid injections, radiofrequency ablations, and ultimately surgeries. So this would be the best option there is. So if you'd like to learn more about some of our interventional orthopedic techniques on Facet Syndrome, feel free to give us a call, or you can reach out to us on any of our social medias, visit our websites, and if you're interested in getting an evaluation and see if this is appropriate for you, feel free to come in and we can have that conversation and examination and go over all the treatment options for you. Thank you. Have a good day.